Good morning, Lady Victoria. Good morning, listeners out there. You're welcome to another edition.
And today we're talking about something very important, arthritis. Dr. Kingsley, before we start, is arthritis peculiar to only aged people, aged 45 to 50? Do people in their mid-20s or mid-17, 16, do they also go through this arthritis? And what is arthritis?
All right. Before I explain that, let me go to the last question. What is arthritis? Arthritis simply means inflammation of the joints. Inflammation of joints. That is what is called arthritis. The joints are the places in which bone meet together. Where they join together, we call it joints. So arthritis simply means inflammation of the joints. Now, inflammation means swelling. That is what is called inflammation. Now, the first question you asked, is it only aged people, middle-aged people, like people in their 50s, which are middle-aged people, or people above 50, maybe aged people like 70? Are they the only people that normally experience arthritis? I want to let you know that arthritis is universal. It's for everybody. Yes, both young and old. So that's why even little ones below 20 can even have problem of arthritis. That's why in arthritis there's a particular type of arthritis that is called juvenile arthritis. So that juvenile arthritis is a particular arthritis that affects young teenagers. So arthritis can affect young and old. So arthritis can affect anybody. So that's what arthritis is all about.
Now, what are the types of arthritis? How many types do we have?
When you talk about types of arthritis, we have up to 100 types of arthritis. But to mention the few, the one common among us here is one known as rheumatoid arthritis. We have the one known as osteoarthritis. We have another one called gout arthritis, and we have another one known as neuroarthritis and also juvenile arthritis. These are arthritis. There are many of them. We have meningitis arthritis and so many of them like that. Do you understand? So, but there are common ones among us which I'm going to deliberate much on. Number one is this rheumatoid arthritis. The other one is juvenile arthritis, and also I'm going to discuss about this osteoarthritis. These are arthritis. There are many types of them, up to 100 types. So arthritis much. Thank you very much.
Now, what are the causes of arthritis?
Yeah, arthritis can come as a result of what? Overweight. Let me talk about when we talk about rheumatoid. So when you are overweight,
obesity.
Oh yes, when one is overweight, the person may have arthritis. Now, secondly, those women that are overhipped, they have too much hip. And when they are in their 50, because if you are a woman with big hip, when you are being advanced, it will add more. So when you add more, in that condition, you may experience arthritis. Rheumatoid arthritis. This rheumatoid arthritis can come also as a result of hormonal problem. Do you understand? When there is hormonal problem, it can also contribute to this rheumatoid arthritis. This rheumatoid arthritis also can come as a result of some drugs you are familiar with persistently. It can also contribute to that. Another thing that can contribute to that is junks. Somebody who takes too much junks, all this refined food, you take them much, you may have this problem of arthritis. Arthritis also may come as a result of one who take too much of, ice things. Those things contribute. Too much of alcohol and even smoking can also contribute to arthritis. But there are some arthritis that come on their own. Those arthritis, medically, we call them idiopathic arthritis. This idiopathic arthritis is a condition whereby the researchers are still researching to know exactly what caused this arthritis. So many people today have arthritis because of one thing or the other. Even self-medication too can contribute to arthritis because this is an inflammation. Another thing that can contribute to arthritis is infection. Infection also can lead to arthritis. So when there is an untreated infection, can also migrate to this, joints and begin to cause havoc. In that condition, the person will have arthritis. Thank you very much.
Now, what are the signs of this arthritis?
Now, signs comes based on the type. Let me start from the juvenile, which is the lower side of the arthritis that normally affects teenagers. This arthritis, whenever you see your child, maybe even that child could be around 6 or 7, 10 years, you understand, begin to have a kind of deformity in walking, and you see that child started having something like K-leg. But before there was nothing like K-leg before, and she complained that it pains her while she's walking. That could be juvenile arthritis. Then this juvenile arthritis can also blind the eyes. It can affect the eyes of that child. Arthritis of juvenile arthritis can lead to blindness. Apart from being blind, it can make a child to be crippled. There are some children that are crippled today as a result of juvenile arthritis. Then we now talk about osteoarthritis. Osteoarthritis is also discovered as arthritis that normally affect women more than men. Yeah, women normally have this osteoarthritis more than men. So because number one, when a woman, that one normally affects women in their middle age after menopause. If that woman is lacking something like estrogen, this estrogen, if there is a drop of estrogen in the body of a woman after her menopause, she may likely have this osteoarthritis. This osteoarthritis is one of the commonest arthritis among ladies today. You see that woman, she cannot climb step. She walk, she will stop. The thing will now hook her.
Or she will use something to hold her
She will
hands to walk.
She will look something to hold herself. At times she will stay a while before she will receive a little relief, and she keep on walking. Within a short time, she will stop again. So a woman with osteoarthritis, it can take her, so many minutes to walk one pole because of inability to exercise her joints to walk very well. So that it normally affects the bone, the joint, and inside the bone you feel pain. In some cases they call it poison. Some people say it's poison. I went somewhere, they said this is poison. It's not poison. This is what is called osteoarthritis. This osteoarthritis can affect the bone. It can make one leg shorter than the other one. Yes, if nothing is done, because as rust normally rust iron, that is how osteoarthritis rust the bone. The bone begin to depreciate. It can make the bone to go smaller in size. You understand? That osteoarthritis. That another thing that leads to this osteoarthritis is another infection called osteoporosis. This osteoporosis is an infection of the bone. From osteoporosis, it can now graduate to osteoarthritis. So this osteoporosis affects the bone. It can make that person like they use pin. There is a pin inside your bone. You understand? If you have that sign, that is a sign of osteoporosis. This osteoporosis also can now graduate to osteoarthritis. This osteoarthritis, now there are so many things that can deteriorate it. Number one, if you take ice water, something chilled, it becomes worse, it will deteriorate it. Now, when your cholesterol is high, it can also deteriorate it. If you are one who eats too much of red meat, it will deteriorate it. If you are one who take all these noodles much, you are so friendly with noodles, it will deteriorate it. Even I want to tell you, there are some drugs you can take, it will deteriorate it. So this osteoarthritis come up when person have problem of osteoporosis. From osteoporosis, it can now lead to osteoarthritis. Then another one is this rheumatoid arthritis. How do you know that this is rheumatoid arthritis? Now, you see that person having swelling on the joint and pain, severe pain in the joint with swelling. At times when you look at your joints of your knee, the thing swells. It doesn't allow you to kneel down. It doesn't allow you to climb step. the thing come up with a very dangerous pain. At times, the victim find it difficult to sleep at night. The person also, this rheumatoid arthritis, back it up with what we call insomnia. The person find it difficult to sleep. Do you understand? So this thing give pains, very, very dangerous. The person begin to have pain. That's in the joint. That one is called what? Rheumatoid arthritis. That one is called rheumatoid arthritis. Then there's another arthritis that one is called gout arthritis. This gout arthritis, do you know where it normally affects people? In their fingers, finger joints, your fingers. Then you see that person in gout arthritis.
Is it the one they call Orimbo?
Not Orimbo.
Okay.
But if you are there, you have this problem of arthritis, or you have been suffering in it, you have a mother or father who have any of this arthritis, you can WhatsApp me, you can call me, you can come closer to me, you can come to my clinic. Please dial this number 080 355 120 83 080 355 120 83 or 081 87 21 081 87 87